The meeting is called to order. This is the continuation of the January board meeting 2019. My name is Victor Law, the president of the board, and I'd like to do a roll call to establish a quorum. Let's start with Ellen.
Alan Shad, professional member.
And I get my own mic right now. Debbie Veal, professional member.
Lavanza Butler, professional member.
Greg Lippy, public member.
Victor Law, professional licensee.
Stan Weiser, professional member.
Ricardo Sanchez, public member.
Okay, a quorum is established. Last night we stopped at agenda item number 10, so we move on to agenda item number 11, which is the Legislation and Regulations Committee report, the chairman being Greg Lippy. Greg?
Good morning. Welcome. Okay. The first thing that we did at Ledge Reg was we had public comment for items not on the agenda. And what was discussed, our representative from the UFCW discussed SB 1442 and mentioned that the legislation, in their opinion, was broad and to allow the board to develop the specificity through regulation. Anyway, they requested the board to promulgate regulations, and they're going to be filing a petition to request the board to promulgate the regulation. They hope to file the petition before the next board meeting. This issue came back later in the afternoon at the Enforcement Committee, and there was a lot of discussion. There was not a conclusion. However, it is to be watched and determined as we go on. The next thing was board proposed legislation. In this category, there are 9 proposed measures. The first is to amend section 11165 of the Health and Safety Code, which will expand cures reporting to include Schedule 5 controlled substances and reduce the time frame for reporting to the cure system to 1 working day. The second, yes. Yeah, absolutely. Oh, I wanted to mention, I'm not going to be stopping at each one to ask, so if you have something to say, please come on up.
Button. Thank you very much. Hey, don't shock me over here. Okay. Steve Gray, pharmacist, speaking on my behalf. I would suggest that the board, as this goes through, I'm not opposing it. I think that there's merit on both sides, but this is an opportunity to kind of clean up that section of the Health and Safety Code. You may remember that we had some issues with Vicodin and other drugs, that the California controlled substance lists are different than the federal controlled substance lists. And this came out particularly in the Schedule 2 regulation, where you have to do an inventory and reconciliation every 3 months. And it was agreed that we had to be careful and indicate at that time that that was according to the federal controlled substance list, because at that time Vicodin was all Schedule 3 in California. Well, there are still some anomalies like that. And there will be in the future, because California has the right to have its own controlled substance list. And you may add something or move it from one place to the other under California law that is not reflected in federal law, or federal law may change and you haven't updated California law. But as Josh Room verified that at that time, that under California law, Health and Safety Code, every reference, unless specified otherwise, is to the California Schedule of Controlled Substances. So since you're touching this area of the law, you might want to take the opportunity to clarify that for cures, which one are you talking about? And other parts, and maybe parts that affect the prescribers and so forth. So it's just a thought that, because the legislature doesn't like you to come back and say, oh, next year we forgot to do this and so forth, and this is going through, you might want to do that.
Thank you.
So the bill last year was actually pretty controversial getting it through, and that's why it was limited in scope. I would suggest that we move forward with the proposal as is. And should the board believe that there needs to be a larger reconciliation, my recommendation would be to do that probably as part of the sunset review process.
Okay, fine, thank you.
Good idea. Okay. Hi,
Robert Stein, KGI School of Pharmacy, speaking for CSHP and CPHA. The bill that we talked about yesterday that we're sponsoring that would add Schedule 5 controlled substances to 11165 does not include the language to change the reporting period from 7 days to 1 day. Just want to point that out. Thanks.
thank you. Okay, the second item in this category. Oh, thought somebody was going to speak. Okay. Okay. This one would establish that a passing score on the NAPLEX or CPJE pharmacist examinations would be valid for licensure only while the occupational analysis that was used to develop that examination is valid or was replaced no more than 1 year prior. Third, to create a new licensing category, advanced pharmacy technician, which would establish the licensing requirements, detail the proposed duties and requirements, and define the conditions a pharmacy must satisfy if using APT personnel. Fourth, to create a new, sure.
I'm sorry. I talked to a couple of dean, and they are interested in having some kind of proposal to have a different pathway for become an APP. So can we put that on the next meeting agenda?
You're talking about an APP, not an APT.
Oh,
This is APT.
oh, okay, technician. Okay, but for the pharmacist.
Okay, for next.
Great.
Yep.
I just want to repeat what I called out yesterday, and I think it was clarified, but there may be a different audience today, in that this particular bill for the advanced pharmacy technician does not have a CE requirement, but it's my intention that I heard that the intention was, as a matter of policy, that there would be a CE requirement for both the hospital advanced pharmacist tech and the regular advanced pharmacist tech. Is that correct?
Yes, and
That's
a
the
fee.
plan.
Okay, thank you. And a fee, I like that one. You got that.
You know, I don't want to jump ahead, but I was going to wait until after you did the advanced hospital.
Yeah,
There's like some feedback.
okay, well, let's see what Danny has to say first.
Well, no, I'm saying there's feedback in the.
Oh,
mics.
feedbacks.
Yeah.
Okay, turn off your mics if you're not.
Okay. Okay, Albert, okay. Anyway, what
Yeah.
I'd like to.
It's still there.
Okay, now? Now it's gone, right?
Can't have it
Oh.
off. Okay.
Okay. So what I would like to propose to the board is that, both because of, what Steve brought up, and maybe some of the language in the regs themselves or the proposed that we're looking for a sponsor for, it's not totally clear. And I've also heard a little bit, and when we originally brought this up, that, instead of having 2 categories of advanced technician, to just have one, because there is a possibility that people would fall in the kind of in between them. And we discussed it when this first came up, but I think we're very interested in kind of moving it forward. So I guess I'm feeling that since it's kind of stalled a little bit, I would ask maybe the board if they would consider sending it back to the licensing committee just for us to look at the language, clean it up, add possibly, CE fees, that kind of stuff, but also just have a discussion once again, should we just have one advanced pharmacy technician category as opposed to 2?
If we were to stop that now, what happens then?
So I'm just going to talk loud, and hopefully that works. We don't have an author right now. It is a legislative. It's a legislative proposal, is where it stands right now. So I think it's up to the board. We can delay and revisit the policy at a licensing committee, and then if there seems to be good motivation, try to find an author later on in the process, or we can move forward and handle this through negotiation of the legislative process. Or a third option is look at it with the licensing committee and then maybe make it a sunset issue.
So
I
are you
don't really
making
want
a
to.
motion?
I don't really want to slow it down and making it sunset, because that sounds like really delaying it. So my motion would be to take this back to the licensing committee. I don't want this to be a drawn out thing, but like one meeting of the licensing committee, the one in April, to resolve it and then come back to the board at our next meeting in May and make the recommendation. That would be my motion.
Okay. Well, I'll give you a second on that.
Okay.
Can I talk about the practical implications of that?
Yeah.
Yes, please. As soon as you get a battery.
I'm just going to talk loud. That's
That's
okay.
why I asked what happened.
Oh, it doesn't pick up. Sorry. Oh, there we go. Okay, I'm back. You're so
Look
excited.
at, she's
I know.
got 2 mics now.
So from a practical standpoint, I think May may be a little bit late. Because I've been meeting with various stakeholder groups, and I do think that there is consensus on the policy that the board is trying to effectuate through this legislative proposal, which is to create some sort of mechanism by which pharmacists can be redirected to provide more clinical care services. And so peeling away some of those things. So I do think that there is consensus with respect to the policy goal of the board. Based on some of the discussions that I've had with people, where there is not consensus is going to have to be worked out, and it's going to probably be through legislation, through the legislative process. And so we could pursue with the understanding that perhaps we put it in a separate vehicle instead of one with all of our other legislative proposals, so we can not hijack movement with the other ones and try to make that, and perhaps that becomes a 2-year bill instead of a 1-year bill. And so we can still move forward, but May is a little bit late to be putting in significant policy into legislation.
Well, you could have a meeting sooner than that if you wanted to.
Well, I mean, it's not our meeting. I think it's the full board meeting, so we'd have to bring it back to the full board, right?
But I agree with Ann. I think we should move forward, and then you could do a lot of compromising afterwards. Whatever deviation, you could amend it at that time.
I guess
Otherwise, you're going to have to go back.
only-
You could amend it. It's still subject to amendment, even after when you find a sponsor. So
Correct.
might as well just go ahead and move forward with it.
My only worry is that I kind of like to have our language. So I feel like sometimes, as we have experienced, even like with that bill with the security forms, is that it gets out of, once we don't lose control, then it doesn't become our language, and we get 12-digit serial numbers. We get enacting on January 1st when that's not possible. So that's my only worry is, through the negotiation process, I get it, but I'm just worried that then we get something not as clean as if we just go back and look at it, make it right, and then have a sponsor take it. But once again, I'll do whatever the board directs. That's just my gut.
Good morning, members. Danny Martinez with the California Pharmacists Association. Yesterday at the Ledge Committee, I made comments that CPHA has concerns. We don't have an official position on this. Our Ledge Committee meets in March. But we do have concerns about this and the Advanced Hospital Tech Bill. I know that the board tried very delicately to avoid the issue of ratio, and as I mentioned yesterday, I don't think that's possible with with either of these proposals. At some point, ratio is going to need to be addressed one way or the other. Right. And as we've seen the last 2 years, that is really a hornet's nest of an issue, both in the legislature and obviously outside of the legislature. So if I don't think that would be the worst idea in the world to bring this back to licensing, because that fight can happen there within the licensing committee. I shouldn't say fight, I should say discussion, if I'm being political. Yes. And because otherwise that issue is going to be taken up in the legislature, where it is far more toxic at this point. Having spoken with a couple of other interest groups, they're concerned about this as well. Maybe not for the same reasons, but they see the ratio issue being front and center on both of these proposals. So I would urge the board to consider Debbie's motion again, and perhaps, I mean, there is time, as I mentioned before, this is the beginning of a 2-year session. There are some policies that are created in January and signed in September, and then there are some policies that are created in August and signed in September. It happens that way. So that possibility exists, but I really think that if the board's goal is to have a consensus policy on the entire proposal, I think that's more effectively done at the committee level with licensing and then moving forward. Because if it goes through the legislature, then you have other entities that have not testified before the board, who are not made known to the board, who bring up issues that nobody even considered. And so those are my comments. Don't know how the board feels, but I would urge you guys to reconsider her motion on that.
Thank you, Danny. Steve?
Steve Gray, pharmacist. Danny's right. This has been a discussion going on, and in fact, when I was president of CSHP, CSHP published an extensive paper for the public on the whole issue of technicians, licensure, ratios, all of that type of thing. And that was published in the January issue of 2014 of their journal. You might want to look at that for reference. But I would support what Debbie's talking about for a different reason, and that is, and what Ann's talking about. I think one of the ways to do this is to go forward, but as it goes forward, it is, as Danny said, likely to have some suggested amendments and so forth. And I think going back to the licensing committee, or maybe earlier than May, but going back to the licensing committee to have an open discussion gets you ready for, as a board, to address from a policy point of view some of those proposed amendments that might come out of it, either in the first year or the second year. The second thing I want to talk about is that that I am against one advanced licensed technician, because the biggest issue, the biggest practical issue that other states had to address, ASHP had to address, ACPE had to address, and they all did this at a big conference in Dallas, Texas, and I was there as one of the invitees, was if you require community pharmacy technicians to be qualified and certified for something like sterile compounding, it's very impractical. 80% or more of community pharmacies never do any compounding, let alone doing sterile compounding. Every hospital has pharmacy technicians, if they have a pharmacy. That's another issue. Every hospital has pharmacy technicians involved in sterile compounding. And so what Oregon realized, for an example, when they went down that path requiring ASHP accreditation, was that in order to get licensed technicians, the retail operations, Walmart, the chains, and even independents, had to pay proposed pharmacy technicians to go through the education, training, and certification. And so they would have them on the payroll for weeks just to go through that training and pay the tuition, et cetera. And then as soon as they got their certification, then they got their license, guess who hired them? The hospitals. And said, thank you very much. And the home infusion pharmacies and the specialty pharmacies, the few, community pharmacies that are specialty pharmacies. So there's a definite reason, a very logical, practical reason, is you want people going down actually two different paths. There's a lot of pharmacy technicians that never want to touch sterile compounding. And there's others that see hospital, sterile compounding, home infusion as their career path. And so I would say that there still needs to be two separate. And then one thing I noticed in one of the two bills, and I forget because I'm old, that it says that the board says that they'll have to pass an exam. And I think that needs to be maybe discussed, especially because are we going back to pre-2000 and whatever it was, before the California board recognized Naplex, and now you're going to have somebody develop a licensing examination that's only used in California, unless there's some other thing in mind, like maybe there is a national one, and then go through all of that. And remember, there's 40,000 technicians, pharmacists in this state. There's 80-some thousand, or roughly, pharmacy technicians, and the turnover rate is really high. So I think that it might make sense to have an exam for hospital pharmacy technicians that have to be examined for their sterile compounding skills, but it may not be necessary to have an examination for an advanced practice technician that's working in the outpatient pharmacy, given the other qualifications you had in mind. So I think, one, it ought to go back to licensing for discussion, but I would not believe you should support one bill combining both concepts. Thank you.
Thank you, Steve. Yep. Come on, Fred.
Good morning, sir, folks. My name is Fred Mayer. I represent two groups, the California Alliance for Retired Americans and Pharmacist Planning Services, both nonprofits, consumer advocacy groups. The latest edition of Chain Store News that just came out January shows that pharmacy technicians in Idaho are giving immunizations. It's time as a consumer advocate to look at the big picture. Pharmacists are bombarded. We talked about this all day yesterday, how they can't be giving flu shots at the same time they're doing counseling, at the same time they're answering insurance programs, at the same time that money is a big issue. So I want you to replicate and look at the Idaho Pharmacy Board of Pharmacy, who's already adopted a certification program for pharmacy technicians. I urge the California board to have two types of technicians as a consumer advocate. One would be the technician that counts pours and types, that helps us in the back of the pharmacy to get the prescriptions out, and we need that pharmacist, as we discussed yesterday, the pharmacy technician at all times. The second one would be somebody that could help us with immunizations. Last year, according to the CDC, we gave 42% of all flu vaccines in the United States. If they can do it in Idaho, I don't see our people not doing the same thing. And again, what I'm asking for here, we would like to support this, and again, being old, I'm not sure which direction you're going, and I haven't heard the earlier, came in a little bit late because of traffic, but I'd like to see two types of quality certifications. There's absolutely no reason you can't give us help with better trained technicians. They've got to be certified. They got to be qualified. We want, as Steve says, we want some board examinations. How you do this, I don't know, but we need the best pharmacy techs available. We don't want them giving immunizations. We don't want them in the back unless they're trained. So PPSI and the California Alliance for Retired Americans would be absolutely for increasing the pharmacy role by giving us better ancillary personnel. And again, thank you for your time.
Thank you.
That's one of the duties of the advanced practice technician.
Yes.
Yes, it's okay to do immunization. If you look at one of the attachment behind.
Yes.
that's
But
part
the
of
quicker
duty.
the better.
If
And
it's
2 years ain't going to cut it. You need to move it because we're doing it now and we're overwhelmed and we're making more errors in prescriptions, and
All right.
we'll talk about
Hey,
that
yeah.
later.
Thank
I'm
you.
not sure I can get up, folks. Yeah.
Okay. Okay, we have a motion, we have a second. Do we have any more discussion?
What is the motion? What is the motion?
The motion was to send this back to licensing.
Send both the bills back to
Yeah,
licensing
send both
to kind of
the
vet it out.
APT for Advanced Hospital and for the rest of pharmacy back to licensing. So
But you don't think licensing could be talking about that while we are promulgating that on the legislation? And you could always prepare the rest of the amendment while we are getting a sponsor and go through the legislation. During,
yeah.
during the negotiation part, you could always come back with the preparedness that supplement with whatever discussion later before May that you guys could do it.
And, and I guess I'd look to you. I didn't think that we could handle it that way.
Can we handle it that way?
So I think it depends on the scope of the changes that I think the licensing committee would be offering. If you are taking, if we believe that the basic tenets are correct, advanced licenses, 2 categories, and we're massaging the language, or we're like exam, no exam, exam for the hospital, not for that, the basic tenets, then I think you can move forward with the proposal now and handle that through amendments to legislation. However, if you think that the basic tenets are going to be changing, right, consolidating them or something like that.
Can I interrupt you just?
Yeah.
So by moving forward, you're saying don't send it back to the committee.
I think you could send
Right.
it back to the committee to give staff policy direction as it moves through the
see.
legislative process. But if you feel like the basic tenets are not there, I would suggest that if that's the will of the board, then I would suggest that you not put it into legislation right now, because we're not quite sure what our end goal is. Do you know what I'm saying? And in the legislative process, once we decide to sponsor legislation, it's really the author's bill. We are advocating for it, but they make their decisions independent of us. We can ask or say, yes, as the subject matter expert, we believe these are appropriate or these are contrary to the board's policy, but it's no longer our bill. So when it goes into the legislative process, you just have to, I can ask, we can all ask, but it's no longer ours. Unlike a regulation where you're the ultimate policymaker.
Can I add something to that as well? Everything she said is absolutely true. In the legislature, generally sponsors will, authors will respect the sponsor's wishes most of the time when the sponsor asks, don't amend, or this is the language we want, or whatever. That doesn't always happen, and it really does depend on the author. The other thing I also want you guys to consider is that if this bill gets introduced and is sent to a policy committee before the licensing committee meets and provides direction, there could be a case where the committee in the legislature that's hearing this, probably Business and Professions, if it's on the Assembly, or Senate Business and Professions on the Senate side, they may have amendments of their own that either may have nothing to do with what you're talking about, or or have something to do with what you're talking about, but not exactly what you want. And to then modify it after that should pass that committee, there's a very increased likelihood that that particular committee will call that legislative item back to the same committee, and you may miss legislative deadlines at that point. Does that make sense?
Yeah, but I think that could happen no matter what, right? I mean, even if we take it back to licensing, even if we, clean everything
Well,
up.
I'm saying that
still-
you may find a 1-year delay anyways, regardless of whether you decide to meet or not. Because legislative committees are very, very picky when you change whatever was changed in that committee. If it's not substantially similar the entire way, that committee, as long as that bill is in that house, has the right to recall that bill back to that committee, where it could be forced to miss legislative deadlines and then prevent it from moving forward. So just wanted to give that from a procedural standpoint.
So do you want to keep your motion? Do you want to withdraw it? What do you want to do?
I mean, I guess I'd like to hear the direction of the board.
Okay.
I'd like to keep my motion. If it's voted down, I understand.
so-
But, I mean, and to your point, Ann, I do feel like, the basic premise is right. I think that there's some things we need to clean up, and my only worry is letting the legislature do that.
But do we have a choice? I mean, it sounds like the legislature, we could do whatever we want, and it sounds like, and the legislature is going to do whatever they want, and regardless.
So my point was, let's put our best foot forward, and it sounds like there's some cleanup that we need to do, but it sounds like even if we put our best foot forward, it could get derailed.
Right.
Yeah.
So one would wonder, is it not a reasonable thing to just go forward with it? I mean, we kind of have the train on the tracks, and as Ann says, we pretty much know where we want to go with this, and the details are either going to be in our control or out of our control.
I'm fine if the board, sorry, I don't know why I'm doing the opposite of Ann. I keep ungreening myself. I'm fine. I would like the motion to go forward, and if the board wants to
Okay.
vote it down, I would like the
That sounds
direction of the
reasonable.
board.
But before we do,
I mean, I guess what I'm saying is not the direction of Debbie, I want the direction of the board. So if I pull it down, I feel like Debbie's making the decision. I want the board to make the decision.
Okay.
Steve Gray again. I think one thing, I don't want it to get lost, by going forward with two bills, the issues may only be with one bill. And if the ability for outpatient pharmacy technicians to help with immunizations is a high priority, then it may be that you say, well, okay, let's back off on the hospital one if that's where the controversy is because of the exam or whatever, or ratios or whatever. But then that still leaves you a bill to go forward and get some help for 80% of our pharmacies out there with technician duties. And the second thing is, and I've got considerable experience in sponsoring legislation over the past 30 years, and a lot of it depends, quite frankly, on who you get as the author. If you get a powerful author and they've made a commitment to you, especially like if it's a committee chair or someone like that, then the likelihood that someone else is going to be able to come in and really screw up your bill is lower. It's much lower. So selection of the author is very important, and I'm sure Ann and everybody knows that, and will be working on trying to get the best author they can to carry this issue. Thank you.
Okay.
I appreciate that, because actually I do agree with Fred that for community pharmacy, some of these things we do want to keep moving forward.
Fred Mayor again. I just want to emphasize that I'd like to ask the board, I've got this article, I'd like to introduce it in the official minutes so it shows that the March 14 or your next meeting, wherever this comes up, that this proposal is an Albertsons store-wide proposal. It's been done for 2 years for pharmacy techs giving immunizations. And the only thing I'm asking here, Mr. Chairman, to introduce it into the official record, that it's nothing new and they're going store-wide. First, they're starting in Idaho, so it's already been established. So to take 2 to 5 years to get through legislation for us consumer advocates is not practical. We need the flu shots now, and the pharmacists need the help. Thank you, sir.
Thank you.
Yeah, and I think, Dr. Mayo, we agree with you 100%. And actually, when we originally, Mr. Weiser was the chair of the committee, we looked at the Albertsons model, and I think we all embraced it and agree with you 100% that we need to get some relief to the pharmacists.
Do I need an official vote to get something into the official record? I just want to insert this article about the Albertsons doing it.
I would
with their
rather not have
pharmacy
anything
techs.
introduced into the minutes unless the board has had an opportunity to read it and understand it. And so, no offense, Fred, but as far as putting something in the minutes that I, as a board member, haven't had a chance to review first, I'm opposed to.
Thank you, sir.
I think there's a little confusion. His comments and whatever he submits will be part of the minutes,
Right.
right?
I'm
So-
fine. I'm fine with the comments.
He just
But
doesn't want the
evidently,
article.
Mr. Mayor wanted to introduce an article that he had
And
written into the
if
minutes.
we accept that article, and that will be part of the record.
Yeah, without me reading it, I would rather not have it in the minutes.
No,
I have it in the car. I'll print it and make copies. Can I do that this afternoon?
yeah, I mean, the board doesn't have to agree with it. I mean, if I submit something in a public hearing, and Counselor, correct me if I'm wrong, whatever this board accepts as part of that public process will be part of the record, or part of the minutes.
Not necessarily.
What?
It exists in the board's record, but the board's minutes generally do not reflect every word verbatim that the board covers. They tend to be a summary.
Sure.
So even though it would become part of the board's record for some period of time, the minutes themselves tend to be an overview.
Okay.
Yeah, and that's,
And it has to do with how long you keep them. I mean, it's a
Could
records
we just-
retention issue. You don't want 50 years from now your minutes to be
sure, I mean,
volumes.
Okay.
Yeah,
This-
for
let's
example,
just
some
move on,
boards
okay?
have, for example, some boards have court reporters, and they want everything verbatim. We don't do that. So we summarize. And so the summary of his comments will be part of the record part of the minutes. And that's how we've historically done it since I've been on this board for 12 years.
Fine.
Could I just ask, as the chair of the licensing, that his article be put in our licensing packet? Because a lot of times we have relevant articles. Why don't you just put it in there? And then the licensing committee will have a chance to read it ahead of our meeting.
That would work fine with me.
Okay, we're going to take a vote. We have a motion, we have a second.
Okay, what is?
Do we know what the motion is
The motion
now?
is sent back to the licensing
The motion
committee
is to send this-
or to move forward?
Right, the motion is to send it back to the licensing committee.
Oh,
Okay.
So you send it back.
So, motion and second. All those in favor of the motion, raise your hand. You're in favor of sending it
Send them
back
back
to
to the
licensing?
licensing though.
I think I saw.
Oh, not to move forward.
All right, let's do this again.
Let me clarify my motion. My motion is to take these two bills and send them back to licensing to clean them up, get additional comments, and then bring it back to the board probably in May. So if you don't agree with sending it back to licensing, you would vote against the motion.
Right.
But are we going forward with the legislation while you
Right.
are doing all the other little amendment back to the licensing?
If you vote it down, it would
Or you have to,
immediately be
you have to vote
looking
it
for
down,
a
your
sponsor.
vote
have
down
to
your
vote it
first.
down to
Okay.
go ahead with it.
All
To
right.
get it sponsored. It's going to go to licensing to be reviewed if you vote for it.
All right, I got it.
Before we vote on that, just want to make sure. Danny, a quick question for you. End of February is the deadline for bills to be introduced.
Yes, that's correct.
Yeah, so I just want to make sure what we're meeting those deadlines. I don't want to do something else.
So, here's a dirty little secret that I'll reveal for the board's purposes. The bill introduction deadline is not really a bill introduction deadline.
Yeah.
And so, there's opportunities to amend bills, essentially create new bills midway through the process. What needs to be submitted by the February deadline is a physical
bill number
that a sponsor can either include content or what they call a spot bill, just include intent to sponsor something.
2 lines, that's
Yeah.
all.
Right.
I just want to make sure everyone's clear.
Yeah,
because
so that's
And the reason I wanted that clarity, because if it doesn't get out of licensing, then it has
Sure.
different, procedural hurdles. Not that they can't be overcome, but I just want to make sure we're fully aware of that moving forward.
Okay.
Okay,
All those in-
now let me clarify for the board members. The motion by Debbie is to send this back to the licensing committee to review all this again, and second by Greg, all right?
Right.
So all this in favor of this motion, please raise your hand. Oppose? Or abstain? Okay,
Part, I would say, because I missed the first part of the conversation.
all right, the motion is voted down. Stan, you want to make a motion?
Okay.
May I ask, would the board be agreeable to delegating myself, board staff, to work with the chair of the committee to address some of the language concerns that she has as part of the process? Yes, so we can
Sure.
probably get that cleared up if the board is comfortable with us working with the chair of the license, or whomever you deem appropriate, so that we can address some of those challenges.
Yeah, I'll
That's fine. We
I'll
don't
make the
have-
motion. I'll make the motion.
I
Second
think-
by Stan.
Correct, and the concerns that you're talking about are specifically the CE.
Yes,
Okay,
yes.
and,
All right.
excuse me, the fee?
Okay.
Okay.
Do we have any comments about this? No. Okay.
No.
All those in
All right.
favor?
All
of
those
the-
in favor, please raise your hand. Unanimous? Okay, motion carry. Thank you.
Okay.
Go ahead, Greg.
Okay, well, the next item, I think we already beat to death along with the previous one, which is
But
the,
I'd like to make another motion. I'm kidding.
which is to create a new licensing category for advanced hospital pharmacy technician. Moving along, The fifth item in the category would be to allow a reverse distributor to accept medications for destruction under limited circumstances. The sixth item would be to allow the board to assess an application fee from government-owned facilities. Further, the measure would clarify the fees for updating a licensing record and the fee to reissue a printed license certificate. Seventh item would be to establish USP compounding chapters as the foundation for the board's regulation of sterile and non-sterile compounded drug preparations. Yes. Come on up.
As I remember reading the attachment on that particular bill, and again, I start that with as I remember, it was more than just the compounding. It seemed to say that wherever we have a condition that the USP addresses, such as storage parameters and all of that, that it would also go to the latest edition, right, as a reference.
Yeah.
And I'm not necessarily opposed to that. But if you look at the current regulation, it says, I think it references the 1995 edition. And in something like that, way back. But my point is that earlier, maybe 10 years ago, the board started to update that. And then somebody said to the board, have you read the latest edition? And realized the huge changes between the 1995 parameters and the then current edition, and what that would mean to the industry. And by industry, I'm talking about any place that drugs are stored. And so I would just, I'm not saying, but I think it would be less than a full due diligence of the board, or to at least they would need to get a report from the legislative committee or something about what the current conditions are that you're making part of law. And so for an example, the current edition, the old edition of the USP had storage in like one little paragraph. Now the issue of storage for warehouses, hospitals, and everything else is spread out through several volumes of USP there are now. And used to talk about two things. You either had drugs at room temperature, and room temperature was specified, or they were frozen, right? Now there are several ranges of temperatures, and then a caveat in there that says these ranges apply, or whatever's in the manufacturer's package insert, which means that storage conditions could be unlimited, and you'd have to have a separation. There's now humidity requirements. How many warehouses do you know, or pharmacies, have constant measurement of room humidity as well as temperature? And it even specifies the parameters of what type of equipment you have to have. And again, I'm not saying that this is necessarily wrong, but I think that before you adopt something that blanketly puts these parameters on everybody, you should ask someone to report to you exactly what it is that you're making this major change on, is my comment. Thank you.
What do you suppose the purposes of those refinements are?
A very good question, and that's why I'm not opposing them. I think with the greatest of intent at USP, what they're trying to say that for purposes of stability and for purposes of contamination and all of those things, they believe that is true. But they don't necessarily, having been a part of that process, they don't necessarily look at some of the practical considerations. And maybe it just needs to be more refined. You know, maybe you say that these storage conditions or other conditions only apply to sterile compounding pharmacies, only apply to warehouses, only apply to hospitals. And you don't set out something in motion then where, you know, you have to go back and reverse it perhaps by legislation, that because theoretically it can be read that it applies to every place that prescription drugs are stored, every medical office, every clinic, every 3PL, everything else. Again, all I'm saying is because what happened the last time, and it's even more pervasive now than it was last time after the 1995, is the board charged a special committee, and there happened to be a public board member who was an engineer, and he was given the chair of that. And after reading it, that special committee never brought it back to the board. So I'm just saying that there's things in there I don't think you're aware of.
Because,
I'm sorry.
there, Mr. So, I mean, I understand what you're saying, and I think what you're saying is very practical. But there are many people in the audience who have come forward and said to this body, why don't you just have your regs mirror the regs of USP or the standards of USP? And so, and usually these are compounding entities that come to us and say that.
Right.
And
my response, if you will, those are usually to the compounding process, not necessarily to the entire USP storage and everything that's in USP. So if I've misinterpreted what is proposed, but the way I read it is you're referring back to the latest edition as a whole, all the volumes now of USP, not just 797, not just USP 800, not just 795, not just the sterility testing standards that apply to compounding, but everything else too.
So your suggestion, Steve, is to just name the chapters?
Well,
Would that
yeah, I guess my suggestion is just make sure that the board is fully understanding what they're voting through in legislation.
So the proposal that the board voted on is very specific to the compounding of drug preparations. So it is, I believe what you're referring to is the 1780 requirement that was referencing old USP, and that dealt with wholesalers' storage. This proposal is separate and apart from that because it is dealing with the compounding of drug preparations consistent with USP and relevant chapters. And it is my understanding, and I'll look to legal, but USP standards must be complied with irrespective of whether or not it's in our statute, because if it does not comply with USP, it would be considered adulterated and misbranded. And we have statute that already says that. So for the purposes of this proposal, the opening says the compounding of drug preparations for furnishing, distribution, or use in California must be done consistent with the standards established in the latest edition of the USP, blah, blah, blah. So we're not speaking to the storage for wholesalers under 1780. There is, however, a separate regulation that does deal with that, but this is specific for the compounding.
Right, and what I was saying is it used to be that storage and all those conditions were in a separate part of USP. Now they're spread throughout. So if you're really referring to just the compounding process in 797, 795, or the employee protection or human protection in 800, maybe you have to be more specific. I would just caution you on that.
I just wanted to make one statement. I wanted to thank Dr. Gray for his comments, and that these issues have come up, some in detail and some just overview, to be discussed at the compounding committee. So I'm hoping you'll be present at our compounding meetings.
Okay, thank you.
Thank you, Steve. I have some additional information on this as far as what happened in the committee yesterday. Marie Kottman, compounding with a sterile license, recommended that the board delay the adoption as written. She was concerned with USP 795 non-sterile and implementing all at once as a blanket law. The cost to implement 795 is significant. She was okay with improving the practice. This could create, she was concerned it could create an unfair competition, as not all pharmacies will make the changes necessary and be willing to run the risk. CPHA chimed in supporting the statutory change and stated that any types of change any type of changes in a phased-in approach would be okay, and suggested that this could be worked through as part of the legislative process. And committee member Serpa noted that the compounding committee will be looking at the challenges. And we ended up with staff is to work with council to explore enforcement implementation strategies and to work with some stakeholders on that. Next would be to amend BPC Section 4115.5 to increase the maximum number of hours a pharmacy technician trainee can gain and remove a conflict for completing an ASHP accredited pharmacy technician training program. The type of training program is currently one pathway to licensure. And the final item in this category is to would align the advanced practice pharmacist renewal requirements with the renewal requirements for pharmacists. Next category is proposed legislation impacting the practice of pharmacy or the board's jurisdiction. The legislature reconvened on January 7, 2019. Since that time, members of the board staff have been monitoring new legislative proposals to be brought to both the committee and board for consideration. Such proposals generally impact either the board's jurisdiction or board operations. Deadline, as Danny said, the sort of deadline, to introduce the bills this year is February 22nd, 2019. As it's still early in the legislative session, the board staff have only identified one measure so far. Full text is in attachment 2. The board staff has recommended that the committee monitor the measure but not take a position at the time. And a summary of the measure is that it would require DCA to conduct a comprehensive review of all occupational licensing requirements and identify unnecessary licensing requirements that cannot be adequately justified. DCA would also be required to report to the legislature on its findings. The bill contains additional provisions that either do not apply or impact this board. Next category is regulations. Now, within this category, we have several categories as well, and that's a board adopted submitted for administrative review to the Office of Administrative Law. There's only one in this category, and it formally amends the board's regulations regarding the establishment of compounding beyond use dates as it relates to sterile and non-sterile compounding drug preparations. This one has had no action on it for at least 30 days, and I'm mentioning that because in the past, people have indicated that they wanted to know when something has gone more than 30 days without any action. Okay. Next category is board approved to initiate rulemaking, and it's undergoing pre-notice review by the Department of Consumer Affairs or the Business Consumer Services and Housing Agency. There's 13 regulations in this category. The first group is undergoing review by a DCA council, and that includes 5 items. And the first one in the category establishes the training requirements and certification programs and updates the application for licensure for pharmacy technicians. And this one has what number? Well, if you want me to give you, it's number 1 on your materials. Yeah. Okay, so anyway, that one has gone more than 30 days without any action. The next one is would amend the board's regulations regarding ownership to include provisions relating to trust ownership of pharmacies.
What number is that?
That's it's number 2 under the category board approved to initiate rulemaking undergoing pre-notice review. If you want to know, it's the proposed regulation to amend Title 16 CCR Section 1709 related to pharmacy ownership, management, and control, including through trust. Okay, next item of the 5 in this category establishes the regulatory framework for third-party logistics providers. The 4th one in the category updates the self-assessment forms 17M13 and 17M14 as incorporated by reference in Title 16 CCR Section 1715. Additionally, this regulation updates Section 1715 with clarifying language as to the completion and certification requirements of the self-assessment forms. The final one in this category updates self-assessment form 17M26 as incorporated by reference in Title 16 CCR Section 1784. Additionally, the regulation updates Section 1784 with clarifying language as to the completion and certification requirements of the self-assessment form. The next category are those that are undergoing review by DCA Legal Office. Included in that are 5 additional items. First one amends the board regulation regarding the waiver requirements for off-site storage of records to allow those cited for a records violation to receive a waiver to store records off-site. There has been no action on this in 30 days. The second one in the category establishes regulatory requirements for automatic refill programs. There has not been any action for more than 30 days on this as well. The third one amends the board's regulations regarding the naloxone fact sheet that must be provided to consumers upon furnishing naloxone hydrochloride. Also, no action in more than 30 days.
With that one in particular, is there a reason there has been no action? It began in July. I mean, it seems like we have had, a microscopic focus on this.
So once staff does their work, then it goes through the department's pre-review process. And so from the development stage, we work with our council, and once we submit it, then we have an iterative process with our council, and then it goes into the department's their pre-review process, and there's several steps involved in that pre-review process. But aside from advocating to, move things, it's really, I believe, probably a workload issue for the DCA. Patrick is here. I don't know if you want him to discuss it maybe as part of the DCA update, but we've had presentations in the past from the DCA regarding the pre-review process and the different steps that are involved.
One would say that this is not extraordinary and we shouldn't look for any issue hidden in it.
I do not believe that inactivity on the pre-review process is a sign that there's a problem with what the board is doing.
Okay.
Perfect. A little, excuse me, little comment here. Oh, hi, Steve. I was just looking here. I was just reading the more interesting news rather than listening to the meeting.
Thanks a lot, Alan.
There was a statement on the 17th from the commissioner of the FDA to support development of over-the-counter naloxone. It seems like we're way behind on this, especially in light of that. And so, anyway, that's just a throw out there.
Yeah. I thank you, Steve Gray, pharmacist, and I thank you for that. And that gets right to my point. We have been talking about the opioid crisis for 8 years in California at least. And it's got national headlines. It's a problem. Everybody is moving forward. We've acknowledged in these public board meetings that there's a problem with the protocols that were developed for pharmacists to use. Because they're so complicated, so time-consuming, and everybody's getting ahead of it, where it's making it easier for everybody except pharmacists to dispense and give naloxone to save lives to someone. This is just another example. I'm not saying it's mean or anything, or maybe it can't move forward. And if we know that the fundamental problem is the protocol that we had by statute to have to work out with the medical board and everything else, perhaps this is the time, I know it's a little late, but we've learned from Danny, we've got time, to go ahead and introduce a spot bill that will eliminate the problem, which is the draconian protocol that pharmacists have to go through to give out something that the FDA believes should be OTC to help solve the death crisis that we have not only in the whole country, but especially here in California. So perhaps someone would like to make a motion to have staff develop a bill and find an author that will change that situation so that pharmacists, the ones that are most qualified and capable to dispense naloxone to laypersons, can go forward.
We have a comment from legal counsel.
I would just like to point out that this particular regulation, the only addition it was to change the fact that pharmacies can provide their own fact sheet, so long as it was substantially related to the fact sheet that the board already has provided. So that's the only change really in this regulation. I just wanted to point that out.
Okay, thank you. The other issue goes beyond that. And I don't know if we can do that now or not.
So I think it might go beyond the agenda item itself, but I think that the board could direct staff to maybe place on the next licensing agenda or whatever committee you deem appropriate to reassess the protocol itself and see if there's perhaps a better mechanism by which to help pharmacists provide the product.
Okay, well, I think we should do that. Do we need to make a motion for that? Okay. No, to ledge reg, right. Okay, thank you.
I'm sorry, did you say ledge reg?
Yeah.
Okay.
Okay, the fourth regulation undergoing review by DC Legal Office updates the application abandonment language to include all licensing programs to ensure that all applicants have appropriate notice about the requirements for abandoning an application. It will also reduce the administrative workload associated with the need for frequent amendments when new licensing programs are established. There has been no action in more than 30 days on this. And the final regulation undergoing review by DCA Legal Office updates the board's fees schedule by increasing the board's fees to address the structural imbalance within the board's budget. The next category is regulations undergoing review by DCA Budget Office. There are only two in this category. The first one updates the renewal requirement language to include all licensing programs. It will also reduce the administrative workload associated with the need for frequent amendments when new licensing programs are established. Second one amends the board's regulations. Oh, by the way, that no action has been taken in more than 30 days on that. Next one amends the board's regulations regarding the duty to provide consultation for mail order pharmacies. And once again, no action in more than 30 days. The final category is undergoing review by Business Consumer Services and Housing Agency. And that one is a proposal which establishes regulatory requirements for pharmacy technicians working in a remote dispensing site pharmacy. And that one has not had action within 30 days. As we can see, there's a significant number that have had no action in more than 30 days. Anyway, that concludes my report, except that I will let you know that future meeting dates of our committee are May 7th, July 24th, and November 5th. Thank you for enduring the report.
All right. Thank you, Mr. Lippy, and your committee members for the work. Before I move further, we have two board members came in since, and I would like them to introduce themselves. Starting from the right-hand side.
Ryan Brooks, public member.
Maria Serpa, licensee member.
Albert Wong, professional member.
Okay, thank you. Let's move on to agenda item number 12, which is the executive officers recruitment. As you guys are aware, with the retirement of the last executive officers, we have a search committee. It consists of me and Mr. Alan Shedd. Last month, we've been busy interviewing candidates, And we have finalized some candidates' future for the whole board interviews. That probably would happen in March. And I will disclose further to the board members at the closed session. But at least just to tell you guys that the process is in place and we're working on it. And the next item is agenda item number 13, update from the Department of Consumer Affairs. Oh, you have comments from the public? Yep.
Just clarify, you said that final interviews are when, I'm sorry?
Final interviews will be in March this year.
Okay, thank you.
Yeah, that,
Any comment, Laura? No. Okay. I think we have some representatives from the DCA. Patrick, are you in? Okay, please come forward.
Good morning, President Law, Vice President Lippy, Executive Officer Sodergren, members of the board. It is good to see you all again in beautiful San Francisco. Thank you so much, as always, for giving the department an opportunity to provide an update to your board. For the purposes of the minutes and for the record, my name is Patrick Clay. I'm the Assistant Deputy Director for Board and Bureau Services at the Department of Consumer Affairs. And I thought I'd start this update by sharing some highlights from 2018 from our office and share a few numbers and figures. This past year, our office hosted 9 licensing and enforcement work groups, which, if you recall, are work group sessions that convene staff from across all DCA boards to share best practices in the areas of licensing and enforcement. We also hosted 3 substance abuse coordination committee meetings, which helped redefine some of the ways that boards are able to do drug testing for licensees who are in diversion or probation because of substance abuse. We also hosted 4 directors' quarterly meetings, an opportunity for executive officers to connect directly with the DCA leadership team. And then finally, we also hosted 2 board leadership teleconference calls, which were opportunities for board presidents and vice presidents to connect directly with DCA Director Dean Graffilo and members of the executive team. We hope that these opportunities were good moments to really promote open dialogue and really further our collaborative mission to protect California consumers. But we're always looking for ways to improve. So if you have any feedback about what you'd like to see for 2019, we'd love to receive them. So feel free to communicate those suggestions directly to us. Related to highlights for 2018, I also wanted to mention that the DCA 2018 annual report is now available online, and that report provides a much more comprehensive review of the department's activities for 2018. It will be a full accounting of achievements for all of the 38 boards, bureaus, and commissions that make up the DCA family. So if you'd like to review that report, also if any member of the public would like to review that report, it is available online at www.dca.ca.gov. My next update is related to the transition to a new administration. And as you all know, on January 7th, 2019 marked a really historic new era for our state as the state sworn in Governor Gavin Newsom as the 40th governor for the great state of California. We at the Department of Consumer Affairs are incredibly excited to be part of this new team, and we will do all that we can to further the governor's mission. The department has been in touch with the transition team, and many new and familiar faces have been appointed to positions within the governor's office. And as for current gubernatorial appointees, the message is that there is no action on your part needed. There's nothing that you need to do at this time other than continuing the great work and service that you have been doing. Our office will maintain close communication with the new team that the governor has assembled, and we will be in touch with them continuously regarding appointment vacancies and pending reappointments in the near future. Related to the new administration, I also wanted to mention the governor's 2019-2020 budget. And as you all know, on January 10th, the governor released his proposed budget, which outlined his fiscal priorities for the state of California. It is based on the driving idea of a California for all. It proposes to pay down debts and pension obligations. It continues to build on a robust reserves for the state while making significant investment in housing, childcare, healthcare, preschool, and higher education. And it also proposes some significant changes in the way that the state would do purchasing of prescription drugs. The same day that the budget was released on January 10th, the department held a teleconference meeting with board leadership, executive officers, and bureau chiefs to discuss the budget and to review proposals within the budget that are specific to the Department of Consumer Affairs. And our fiscal and budget team will follow up, if they haven't already, with each of our individual programs, including the Board of Pharmacy in the coming weeks, to discuss individual budgets in greater detail. My next update is a quick note on Assembly Bill 2138, which was discussed yesterday, which, as you recall, is a legislation that limits a board's ability to deny a license based on past criminal convictions. Because AB 2138 affects nearly every board and bureaus at the Department of Consumer Affairs, our department have taken steps to support our programs to make sure that we achieve a successful implementation based on the July 2020 deadline. It is important to note that in order to stay on track, action will be required by all programs by May of 2019, and the department will continue to work closely with all of the boards to create potential model regulations that may be used as a template for boards to quickly implement regulatory packages. Where feasible, we also want to note that DCA will take the lead on collecting data for the reporting requirements and complete one report for the state legislature. My next update is regarding the Substance Abuse Coordination Committee, which I mentioned in the beginning. And as you recall, there were a number of legislation that required the committee, which is made up of the Healing Arts executive officers, to convene and re-examine the particular issue of drug testing standards for substance abusing licensees. So throughout 2018, we convened 3 Substance Abuse Coordination Committee meetings and wanted to quickly recap the 2 changes that were made to Uniform Standard Number 4, which guides all the protocols related to drug testing. The first changes that was adopted is adding language which allows healing arts boards to approve alternative testing location and testing frequencies for a licensee going on vacation or taking a leave of absence. And that change was added to ensure that a board can still perform drug testing for a licensee traveling abroad while considering the varying types of availability and testing laboratories around the world. The second change is a policy addition that allows the healing art boards to lower the drug testing standard. And as you recall, the current testing standard is in between 54 to 104 times per year. So it allows healing art boards to lower the testing frequency to not less than 24 times per year, but only if the licensee receives a minimum of 50% supervision in the workplace. And that change was added to reduce the testing costs for licensee who are already supervised at their place of employment. Sure, absolutely. So currently testing standard is 54 to 104. The change adds a board's ability to lower that testing frequency to 24 times per year, but only if the licensee receives a minimum of 50% supervision in the workplace.
And since
So, right, so actually we were the ones, the Board of Pharmacy was the program that actually put this forward because our work sites are a little bit different than perhaps a physician's office or a dentist office. So a lot of our licensees, by definition, a technician has to work under the direct supervision and control. And there was no nuance to recognize that, right? So as part of the process, there was a lot of testimony about really the best way to confirm abstinence is eyeballing the person daily. And so when you look at how that is actually even better than testing, the fact that someone cannot work independently, it begged the question, why do we need to adhere to this higher testing frequency? The other thing is the majority of our pharmacists, when they're in some kind of a recovery program, we don't allow independent practice, at least not at the beginning. So again, recognizing the fact that they are supervised, typically 50% of each workday, it begged the question, why are we testing at a higher frequency? I hope that was helpful.
Thank you so much. So hopefully that answers your question. So next update, still on the Substance Abuse Coordination Committee, is that the committee also determined that several other standards may need review. So to that end, DCA will be conducting additional substance abuse coordination committees throughout 2019 to examine and potentially change other standards beyond the drug testing protocols. My next update is regarding the executive officer salary study, which I've discussed at past updates. And as many of you know, the department retained KH Consulting to conduct the executive officer salary study. The project is expected to take approximately 6 months with an estimated completion of March of 2019. At this time, the consultants have conducted an initial review of executive officers to identify themes and challenges, to explore expected outcomes for the study and identified perceived challenges. In December, KH Consulting.
Excuse me.
Yes.
Before you get off this topic, when they're looking at a salary study, are they looking? What criteria are you looking at? Because the challenge with salary studies, you're not comparing apples to apples. Some states require, the executive director to be a pharmacist. Some states, like Idaho, are lower on the scale, but they're not comparative to the state of California. So I want to make sure that salary study is done in a very thoughtful way that takes in all these independent variables.
Sure, absolutely. I can share, a bit more detail. I think some of the factors that will be considered, one is executive officer responsibilities on the board and what exact tasks they're performing. I think another factor that we're looking at is there was a prior salary study that was conducted back in 2011, and part of what that salary study wants to do is analyze how the job responsibilities have evolved over time, and really to try to paint a picture that these responsibilities may have gotten more complex based on maybe the number of regulation and state legislation that has to be advocated for, based on the policy that have to be put in place, the management of personnel. So really analyze how the job duties have evolved over years. The salary study will also look at similar job duties from other states, and if they're comparable positions that could be used to compare executive officers in California to other similar positions.
I mean, I look at, just one final comment, I look at executive officer's salary here, woefully underpaid. I mean, I am absolutely shocked that we could attract anyone for the salary that we're paying for someone to live in the state of California, given the magnitude of what we do. We've always say when California sneezes, the rest of the country catches the cold, right? We're the thought leaders in this area, and we need to make sure the compensation is commensurate to the job that we're doing.
Patrick, and I raised this question before, but make sure whatever the outcome is, make sure that the EO's salary is higher than the deputy one. I mean, it doesn't make sense to me, to anybody else.
Absolutely. Really appreciate the comments, and obviously we've heard it many times, which is why we wanted to conduct that salary study. And as you know, salary increases are dependent upon many different factors and layers. It has to go through agency, the governor's office, and other entities. And really the goal of the salary study is to provide all boards with tools to be able to better justify and increase the chances of the salary increases to be approved through all these different channels.
Oh, yeah, definitely there's public comment after that. After you finish, you could always come up and do public comments.
Yeah. I will do my best to slow down, and as a public servant, I will also stay, and so happy to answer any questions you may have.
I think you're doing great. I mean, it's loud, precise, and get to the point. It's very good.
Thank you.
We like that.
Again, salary study is estimated completion date of March 2019. Last segment of my update, administrative notes, but nonetheless important. Close with some friendly administrative reminders. The first one is regarding board member orientation training. As you know, board members are required to complete this training within 1 year of appointment and reappointment to a board. The trainings are 1 day in the most beautiful city in the world, Sacramento. and the training details the important functions and responsibilities of board members. The second reminder is to file your annual statement of economic interest, also known as Form 700. It is required by the Fair Political Practice Commission to report potential conflict of interest. Filing deadline is April 12, 2019, and can be conducted online. You are required to file even if you do not have any reportable interest. And then my final note is that 2019 is a mandatory sexual harassment prevention training year, which for the Department of Consumer Affairs, which means that all DCA employees and board members are required to take this training, even if you took it last year. The training is online, interactive, can be completed at your convenience. At DCA, we want to make sure that we do all that we can to promote a safe working environment for all. Of course, if you have any questions about any particular trainings that you have, feel free to connect with your executive officer or any members of the Board and Bureau Services team. We would be happy to help. So that concludes my update, and I'm happy to take any questions that the board may have.
I have a question.
Okay, board members, Stan?
Patrick, good to see you again.
Good to see you as well.
Thank you.
Thank you for having me.
I'm not quite sure if this is in your wheelhouse, but the program to update, replace the computer system. Do you have any information you can give us on that? Do you have any particular specifics about? Well, we've been looking for updates and improvements in our computer system, and it was my understanding that the DCA was working on that with all the different agencies, and I was just wondering if there's a status report on it.
Happy to take that question back to our Office of Information Services
great.
team and get you an update.
Thank you, Patrick. And again, thanks for showing up.
Okay, Alan?
You mentioned in the beginning of your report about the change in background checks with employees registered with the board, licensees, that it's going to be due in 2020, and we have to have our information in by May. Do we have that information? Have we talked about that? Do we have to do anything before that date? Is there any committee that has to do anything?
Yes, and it's yours.
I know, that's kind of what.
At the last committee meeting, staff was directed to work with council. We're going to be doing a gap analysis to see where or if changes need to be. We're also going to be looking at whether or not there's an opportunity to do some statutory changes to perhaps build some additional fences similar to some of the other programs that we did. So the March meeting, there will be an opportunity.
Great.
Patrick, can you give some update on what's causing the delay of relocation?
Many factors are involved with moving an office, many of them outside our control and many of them within our control. There's a number of inspections that have to be done. So I can check back with our business services office in terms of what are the factors, but I know that they're trying to move as quickly as possible.
Any other?
And part of it is just want to make sure that, when you move in, it's a safe place for all employees.
All right, Patrick, let me ask you one thing here. A lot of these proposed regulations by our board, they're subject to all this DCA preview. Some of this been over 6 months. Some of this is just a whole house cleaning bills. Now, do you have somebody who regularly monitor the progress and try to expedite on our behalf?
Obviously, regulatory process, also a lot of layers to go through. If you have particular regulatory packages that need to be expedited, happy to flag them for the legal team, and I can take that feedback
We
as
have
well.
lots of them.
Yes, and with our 30-year programs, it can combine to a lot of reg packages, but happy to do our best to expedite.
Yeah, with the new
ones that-
administration, I would appreciate you expedite a lot of this, because it's been
Absolutely.
sitting like this, just like as Steve just mentioned, it came out, the lock zone, this thing is everywhere, everybody's adopting it, and we just need to update our consumer fact sheet. It takes since July 2018, it's still sitting there.
Understood
This
the
is
frustration.
February,
We'll
almost February
relay that message back.
2019.
Absolutely.
So I really appreciate if you could go ahead and speed up the process on that part.
We'll relay the message, absolutely.
Thank you very much. And Any other comments from board members? Okay, you have a comment from Fred, public comments?
Hey, Patrick, glad to see you. Can I get a card from you? And give me 3, please. I'm a nobody. Fred Mayer. I'm a community pharmacist with a public health degree from University of California, Berkeley. I represent a group called CARA, California Alliance for Retired Americans. We're an old friend of the governor's. We have 1 million consumers. The one point I would like to ask you about, Mr. Chairman, do I have a minute or 2 minutes, or what's my time? Is the prudent purchase of drugs. 26 years ago, our group, Pharmacist Planning Service and the Pharmacy Defense Fund, filed 3 suits to stop the prudent purchase of drugs. This is on prescription drugs that you mentioned, item number 6, that I wanted to get information on. The governor signed a bill the first week in office to lower the price of drugs. Our California Alliance for Retired Americans backed this bill 100%. We want to lower the price of drugs. The consumers can't pay for drugs, although us old people are only 12% of the population. We use 42% of the drugs. It's impacting on us immensely. So the points I want to make is 4 quick points. 1, would you come back, or I have to ask the Board of Pharmacy, or I can just go over their head. We would like to have a discussion with you on the prudent purchase of drugs. How's this going to be done? One of the reasons we killed the bill 3 times in the lawsuits against the state of California, it was a lady by the name of Beverly Myers, who was director of health at the time, is because of the quality issue, that we don't want them imported from Canada, and there was a whole host of things. So 1, how does the Board of Pharmacy get involved with the selection of drugs, which is their purview, so that we give quality drugs and at the same time we lower the price of drugs? Number 2, we backed a bill called Senate Bill 17 for 2 years. We've been working through Scott Christman on transparency. This is a bill that the governor signed. How does the pharmacist get involved in any of this? Because I see the state doing this, the governor's already signed this thing, and I'm sure these folks here don't even know that we have a prudent purchase of drugs that the pharmacists. So how do we get involved in that thing? Third thing is this transparency bill. How are you going to make this known to us consumer advocates of what you folks are doing on lowering the price of drugs? And I should stop there with the final thing saying, we've been studying it for 3 years, California Alliance for Retired Americans. Here's a 20-point slide on how we could reduce the price of drugs, getting lower prescription drugs, and this is our group, our name, our address, and everything else. So can I stop there and get some questions, answers? Is this okay, or is this the wrong time and place?
As for Patrick to answer. We have to be something refined to the agenda items, so you could answer on that particular issue.
Well, it's prudent purchase of drugs, so that's all I wanted to talk about. Prudent purchase of drugs.
I mean, I don't want to interrupt you, Mr. Lay, if you would like to
You are
address
free to do
it,
so at any time.
But really, this agenda item is an update from DCA to the board, and not that you maybe couldn't have that conversation offsite or sort of high-level review, but really the focus is kind of on the update to the board. And, to the extent that there's a desire by board members to have any of those agenda items addressed at a later date, then you can request that they be put on a future agenda item.
Yes, please. Thank you.
Can I maybe request for the future board to put this on the agenda, prudent purchase of drugs for discussion, and I'll just table what I said.
Yeah, table it until the next board meeting. Yeah, go ahead, Steve.
Really quick, I'm not quite sure if that's really under our purview as the Board of Pharmacy. So I don't want to promise that we'll put something on the agenda that we have no control over.
I think he could approach the board and try to put it on the agenda item. That's all I could say. Whether we could agenda it, that's up to the.
Do you have a question?
No, I was just going to clarify that the president will evaluate whether it should be placed on the agenda based on how it was just presented.
Okay. Comment, Steve?
Steve Gray, pharmacist, and on the subject of the analysis of the executive officer's pay scale, which is on the agenda, I would like to just emphasize what Board Member Brooks said. I have considerable experience in dealing with other boards of pharmacy across the country, And what Mr. Brooks said was particularly notable in that the scope of responsibilities of the California Board and the California Executive Officer is considerably higher than many, if for no other reason, it just has to be in order to get things done. Otherwise, if things couldn't be delegated, that would have to go to the board directly and couldn't be delegated, it just wouldn't get done in California because of the magnitude of the population, the scope of healthcare, all of those things involved. And there are some boards of pharmacy that you go to them in other states and they don't seem to have anything to do except every application for a pharmacy has to be approved by the board. I mean, that just gives you an example. It's like, well, we're here today, what are we going to look at? But on California, I don't know of another board of pharmacy, I don't know of all of them, but that has the authority, as this executive officer does, something that changed since 2011, to issue on their own authority immediately a cease and desist order. A cease and desist order that can shut down a hospital. Because if you shut down the pharmacy services, the hospital has to close. And if the hospital has to close, that can leave a community. It's a heavy responsibility. That can leave a remote community without another hospital for maybe 50 to 100 miles. And that is similar to something that's recently happened, by the way. So it also interferes with that hospital in terms of getting CMS approval to operate under the conditions of participation under federal rules and so forth. So I just think that part alone, and you talk about scope of responsibility and breadth of responsibility, I don't know that any other state has that, and you can see why, for an example, there may be a real need, despite the salary, despite the history on salary, to have the executive officer be a licensed pharmacist. Because who else? Hospital administrators in this state don't even have to be licensed. But why is it that, so please take that back and say, when you do a deep dive to the point that you talked about. What's changed? What is the responsibilities? And you can reach out to the National Association of Boards of Pharmacy and others, and so forth. So I just wanted to emphasize that point. Thank you.
Hey, Steve, are you suggesting that the executive officer should be a licensed pharmacist?
I think anyone that has the authority on their own authority because of a life and death or public safety situation to evaluate what's going on in the pharmacy based on reports from their inspectors and so forth, and they can issue a cease and desist order, should be a licensed healthcare professional in this state.
I would just, I respect your opinion, thank you. Respectfully disagree with that approach. The roles and function are more of a managerial function and creates, in a policy direction function. I don't think we need a licensed pharmacist to make that choice to shut down a pharmacy or not. I'm not quite sure what that gives you, because you have a license. Is your decision making going to be any different? Are you going to come to a different conclusion? And when you get to the level of shutting something down, it's going to be egregious. I think everyone in the room will probably agree at that point in time. And last, historically, we've never done it, right? And so I don't want to create a solution in search of a problem. Next.
Speaking as a licensed board member, I agree with you, Mr. Brooks.
Well, this is not the, I don't think this is not the time, I'm sorry, but this is not the time for this discussion, I'm sorry, so, thank you.
Am I allowed to do that? You're in charge. Am I allowed to ask the record to show that we were asked?
Mr. President, without objection, please let the record show. Thank you.
Okay, Patrick, any other questions for Patrick?
Just for the record that I'm not in charge and I work for you.
Yeah, so. But anyway, okay, well, thank you very much for your attendance, Patrick. Thank you for the update.
It's very smart of you, Patrick.
Thank you. Okay, our next agenda item is closed session matters. So, you have comment?
President, I would like to put on before you go on, I would like to put on the next meeting agenda on a possible new pathway to become an APP for next board meeting.
That would be with the licensing department. Well, I'll forward that to Debbie on your
Yeah.
suggestion. Okay.
Thank you.
The board will go into closed session, and then we will reconvene after the closed session just to adjourn the meeting. So right now, for the time being now, the public, the meeting is adjourned until then, and thank you very much for attending the meeting.